Dengue is a viral infection caused by the dengue virus, which has 4 distinct serotypes: DENV1, DENV2, DENV3, and DNV4. If you get infected with one serotype, you get lifelong immunity to that one, but other serotypes can still infect you, increasing the risk of severe dengue. In fact, subsequent infections with different serotypes can lead to cross-reactivity, where the immune response to the initial infection influences the response to the new serotype. This cross-reactivity can sometimes cause a phenomenon called antibody-dependent enhancement. In ADE, non-neutralizing antibodies from the first infection may bind to the new serotype, but instead of neutralizing the virus, they facilitate its entry into host cells, leading to increased viral replication. This enhances the risk of more severe forms of dengue, such as dengue hemorrhagic fever or dengue shock syndrome. Thus, cross-reactivity between dengue serotypes is a critical factor in the progression from a mild to severe dengue infection in subsequent infections. The primary culprits for spreading dengue are the Aedes mosquitoes, specifically Aedes aegypti and Aedes albopictus. These mosquitoes love biting during early mornings and late afternoons. Rarely, dengue can also spread through blood transfusions, organ transplants, and from mother to baby during childbirth. Once an infected mosquito bites, the dengue virus enters your bloodstream, targeting white blood cells and lymphatic tissues. The virus replicates, causing the immune system to react, which leads to dengue symptoms. In severe cases, the immune response can cause leaky blood vessels, hemorrhage, and organ dysfunction. So, what are the symptoms? Dengue symptoms generally appear 4 to 10 days after a mosquito bite and can last up to a week. Mild dengue shows up as high fever, severe headache, pain behind the eyes, joint and muscle pain, also known as breakbone fever, nausea, vomiting, skin rash, and mild bleeding. Severe dengue, or dengue hemorrhagic fever, can be life-threatening. Symptoms include severe abdominal pain, persistent vomiting, bleeding gums or nose, blood in vomit or stools, rapid breathing, severe fatigue, organ impairment, and sometimes shock due to a sudden drop in blood pressure. For diagnosis, blood tests are essential. The dengue NS1 antigen test detects the virus early on, while IgM and IgG antibody tests and PCR can confirm the presence of the virus later. In dengue, the blood profile typically shows a drop in platelet count below 150,000 counts in Me3, indicating a risk of bleeding. White blood cells also decrease, usually below 4,000 cells AMCIN3, reflecting immune suppression. Hematocrit levels rise by more than 20%, which signals plasma leakage and increases the risk of severe dengue. Liver enzymes, such as AST and ALT, are often elevated, indicating liver involvement, and prothrombin time may be prolonged in severe cases, suggesting impaired blood clotting. Serum albumin levels tend to decrease, showing plasma leakage. Currently, there's no specific antiviral treatment for dengue. Management focuses on relieving symptoms and preventing complications. For mild cases, hydration, acetaminophen, and rest are key. In severe cases, hospitalization, intravenous fluids, and blood transfusions might be necessary. During the treatment of dengue, several important measures should be included while avoiding certain practices. It is crucial to ensure adequate hydration to prevent dehydration and maintain blood volume using ORS or intravenous fluids if necessary. Regular monitoring of vital signs, platelet counts, and hematocrit levels is essential to detect any early signs of severe dengue or complications. Patients should be encouraged to rest to allow their immune systems to fight the infection, and paracetamol should be used for managing fever and pain, as it does not increase the risk of bleeding. Providing nutritional support through a balanced diet, rich in fluids and electrolytes, is important for recovery. Patients should remain under medical supervision, especially if there are warning signs of severe dengue, to ensure timely intervention if complications arise. Conversely, certain things should be avoided during dengue treatment. NSAIDs, such as ibuprofen and aspirin, should be avoided as they can increase bleeding risks. The use of corticosteroids is generally not recommended, as they may suppress the immune response and worsen outcomes. Blood thinners should also be avoided unless specifically indicated due to their potential to increase bleeding complications. It is essential to prevent dehydration, refrain from high-impact physical activity, and avoid self-medication without medical advice. Additionally, caution should be exercised regarding the use of herbal supplements, as they may interact with medications or be unsafe during treatment. Prevention is all about avoiding mosquito bites and controlling mosquito populations. Use insect repellents containing DEET, wear long-sleeved clothing, sleep under mosquito nets, and eliminate standing water where mosquitoes breed. Some vaccines, like Dengvaxia, are available in limited contexts, mainly for those who have already had a previous dengue infection. Dengue can lead to serious complications like plasma leakage, severe internal bleeding, organ damage, and even death if not treated promptly. Those at higher risk include children, the elderly, pregnant women, individuals with pre-existing conditions, and previous infection with a different serotype. Stay safe and healthy.